The surprising truth about your bad memory. Memory loss is often seen as a natural part of aging, but it can also be an early indicator of underlying health issues. Many people don't realize that everyday habits, mental health conditions, or even undiagnosed medical issues can have a profound impact on memory. In this video, we'll explore 9 common yet often overlooked causes of memory loss that might be affecting you or your loved ones. 1. Sleep deprivation. Sleep deprivation is more than just feeling tired. It's a direct assault on your brain's ability to process, store, and retrieve information. When you sleep, your brain organizes and consolidates memories, shifting important details from short-term storage to long-term archives. Without adequate rest, this critical function is compromised, leaving you forgetful and cognitively sluggish. Chronic sleep deprivation, often linked to conditions like insomnia or sleep apnea, exacerbates these effects. Over time, it weakens the brain's neuroplasticity, the very foundation of learning and memory retention, making even simple recall a challenge. 2. Chronic stress and anxiety. Chronic stress and anxiety can wreak havoc on memory, creating a cycle that feels both overwhelming and inescapable. When stress becomes a prolonged state, the body produces excessive cortisol, a hormone designed for short-term emergency responses but harmful in large doses over time. Elevated cortisol disrupts the hippocampus, the brain's hub for memory and learning. This weakening can manifest as difficulty retaining new information or recalling past memories. Anxiety further complicates matters by bombarding the mind with intrusive, repetitive thoughts, leaving little mental space for clear recollection. Tasks requiring focus become more challenging, and individuals may struggle to organize or retrieve thoughts effectively. Over time, this cognitive fog exacerbates feelings of frustration, potentially amplifying the stress-anxiety cycle. Addressing the underlying stressors and finding healthy coping mechanisms are essential for breaking free and protecting memory function. 3. Medications. Medications, while essential for treating various conditions, can sometimes interfere with memory, creating challenges that are often overlooked. Certain drug classes, like antihistamines, antidepressants, and sedatives, are known to cause memory lapses as a side effect. These medications may alter brain chemistry or slow down neural communication, leading to forgetfulness or difficulty concentrating. In older adults, the effects can be more pronounced due to slower drug metabolism or the use of multiple medications. The interactions between different drugs, especially when not carefully monitored, can amplify cognitive impairments. For instance, sedatives might dull cognitive processing, while some antihistamines suppress acetylcholine, a neurotransmitter critical for memory. The result is often subtle at first, misplacing objects, forgetting appointments, but can escalate if not addressed. Adjusting dosages, reviewing medication regimens with a healthcare provider, and exploring alternative treatments can help minimize these unintended effects while maintaining overall health. 4. Nutritional deficiencies. Nutritional deficiencies can significantly impair brain function, with certain nutrients playing vital roles in memory and cognitive health. Vitamin B12, for example, is essential for the production of myelin, the protective sheath surrounding nerve fibers. Without sufficient B12, nerve signals become sluggish or erratic, leading to memory lapses and confusion that can mimic early dementia. Similarly, magnesium supports synaptic plasticity, the brain's ability to adapt and store new information, while omega-3 fatty acids promote cell membrane integrity and neurotransmitter communication. A lack of these nutrients may result from dietary imbalances, poor absorption due to gastrointestinal issues, or aging, which naturally diminishes the body's ability to absorb vitamins like B12. The symptoms often creep in subtly, manifesting as forgetfulness or difficulty concentrating before escalating. Addressing such deficiencies through a balanced diet, supplements, or medical guidance can restore cognitive clarity and protect long-term memory health. 5. Hormonal imbalances. Hormonal imbalances can deeply affect memory and cognitive health, with conditions like hypothyroidism and menopause being prominent examples. Thyroid hormones play a critical role in regulating the body's metabolism, including brain activity. When these hormones are insufficient, as in hypothyroidism, cognitive processes slow down, leading to forgetfulness and difficulty concentrating. Similarly, during menopause, fluctuating levels of estrogen, a hormone that protects brain regions involved in memory, can result in noticeable lapses in recall and mental fog. These changes, while natural, highlight the intricate link between hormones and memory. 6. Dehydration. Dehydration, even when mild, can significantly impair memory and cognitive function, underscoring the brain's reliance on adequate water levels. Comprising roughly 75% water, the brain requires proper hydration to facilitate communication between neurons and maintain focus. When the body is dehydrated, the brain struggles to perform optimally, resulting in challenges with concentration, slower processing, and diminished short-term memory. The effects can escalate quickly, turning minor forgetfulness into noticeable cognitive lapses, emphasizing the importance of staying hydrated for mental clarity and memory retention. 7. Alcohol consumption. Excessive alcohol consumption takes a toll on the brain, particularly affecting neurotransmitter function in the hippocampus, the area responsible for forming and storing memories. Drinking large amounts of alcohol, especially over an extended period, can lead to short-term memory loss, impairing the ability to remember recent events. Chronic alcohol use can cause more severe damage, contributing to long-term cognitive decline and increasing the risk of conditions like dementia. The hippocampus, already vulnerable to alcohol's toxic effects, becomes increasingly damaged, making it harder to retain and recall information. 8. Head trauma. Even minor head injuries, like concussions, can cause temporary memory loss, often leaving individuals with difficulty recalling events that occurred around the time of the injury. Repeated trauma, particularly in contact sports such as football or boxing, can have a cumulative effect, leading to more serious conditions like chronic traumatic encephalopathy, CTE. CTE is a neurodegenerative disease that progressively impacts memory and cognitive function, resulting in long-term memory problems and other cognitive issues. This makes the brain more vulnerable to memory lapses over time, significantly altering an individual's ability to function normally. 9. Untreated mental health disorders. Untreated mental health disorders, particularly depression, can significantly impair memory and concentration. People suffering from depression may find it difficult to focus or remember even simple details, which can often be mistaken for the early signs of aging or dementia. These memory issues are typically a symptom of the depression itself rather than an underlying neurodegenerative condition. Unfortunately, without addressing the root cause, depression, memory problems persist, worsening both the mental health condition and the individual's ability to function day to day. While memory lapses can be distressing, it's important to remember that many causes are treatable or manageable. Identifying the root cause, whether it's stress, medications, or an infection, can help you take proactive steps to preserve and improve cognitive function. By paying attention to these often overlooked factors, you can safeguard your memory and overall brain health. If you or someone you know is experiencing persistent memory problems, consulting a healthcare professional can provide clarity and direction toward the right solutions. Your brain is your most valuable asset. Take care of it. If you found this video helpful, hit that like button, share it with your friends, and don't forget to subscribe for more tips to keep your brain healthy. See you next time.